Good morning, everybody, and welcome to Health Talk. I'm your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with St. Joe, Oakland, Beaumont, and Henry Ford. The topic of our Health Talk is very interesting. This is cutting-edge treatment for depression. Joining us today on my health talk is Dr. Chris Shreve, PhD, and he's the director of his wellness center. He's the author of a book, and he has done so much with all these areas. And he's going to highlight our viewers about what are some of the cutting edge treatment for post-traumatic stress syndrome, depression, and trauma. So good morning, Chris, and welcome to my show.
Good morning, and thank you for having me again.
And then, I would like you to kindly give your extensive introduction because, you have such a whole page filled, so maybe you should share with our viewers.
Yeah, well, today life is simple. Today is my 4th year anniversary working at home as a virtual therapist.
Okay.
Prior to that, COVID stopped and changed everything. But I had offices all over, and I was working, with, mental health providers, psychiatrists, and providing, mental health services and so forth.
Yeah.
Since then, I've started my own depression treatment center, focusing on trauma and depression. My area of expertise is in depression. I focused that on my dissertation, was in depression. And so we're going to kind of talk about some of the cutting edge treatments for depression. A lot of us have come out of COVID and we're not the same necessarily.
Right.
So I want to talk about some of the things that, people are still struggling with. And depression seems to be a number one thing that's happened.
Exactly, Steve. And we went through this COVID era for 2 years. We have been talking about what COVID did to us. Yeah. But this is a new segment of our health talk. We are talking about this cutting edge treatments, and everything seems so interesting, including the mushrooms.
Well, we'll definitely.
Remember, we talked about the mushroom in the middle of, during the summer time, But now, what we are going to do is, we are share all this information with our viewers.
Yes, absolutely. Well, I wanted to just highlight and talk a little bit about, depression, PTSD, and trauma. They really kind of go hand in hand.
Right.
So if we could have the first slide, I can kind of define some of those things for our viewers.
Sure.
So when we look at depression, we talk about feelings that people have that are, characterized by sadness and lack of motivation and feelings of isolation and, those kinds of things which people, really struggle with depression. We also talk about trauma. And trauma is a very unique creature. A lot of us have been overexposed. Yes, trauma, PTSD, they kind of go hand in hand. So I wrote a book a couple years ago about trauma.
I know. I read that book, and we discussed about the book here also. So that was a good one. Yeah, so
that book kind of redefined trauma, in my opinion. And I redefined trauma as anytime we're overexposed to fearful things and under some type of attack. And in my estimation, that is what kind of turns on the trauma circuits, which later can lead to PTSD.
Exactly, right,
So we want to kind of talk about 4 different treatments that related to depression and some of the more cutting edge treatments that are out here. Traditionally in the area of depression treatment, as you well know as a former emergency room pediatric physician, that a lot of SSRIs or antidepressant medications are given to help people deal with their depression. And we also know there are some medications that help with the effects of trauma, especially the anxiety, the sleep issues that are created from, a trauma response and things of that sort. So today we want to kind of highlight 4 different types of treatments that people may not be aware of. They may have heard of some of these things, but I want to kind of highlight some of the newer cutting-edge treatments related to depression.
Yeah.
So we can have the next slide, and we can kind of talk about the first treatment. Now, transcranial magnetic stimulation is a very effective treatment for patients who have non-treatable depression. And what that means is that patients who have tried 3 or 4 different antidepressants. They may have tried psychotherapy. They may have tried, ECT treatment. They may have tried a number of things, but they still are not responding, and so they remain depressed. So transcranial magnetic stimulation is a treatment that actually will beam an electrical current into the left side of the brain in the area of the prefrontal motor cortex, which will then alleviate depression.
That's where they store all the information.
Yes, in the limbic system, the mood center of the brain.
Right,
and so this electric current, it's a little device you put on the side of your head. If you look at the picture on the slide, you'll see it's like a device, and it beams a magnetic current into the left side of your brain. What this does is it causes the neurons, specifically the serotonin and dopamine neuroreceptors and neurosynaptic sites, to start to depolarize. Depolarizing means they start to fire. And so when you get this firing effect of the synaptic nerve sites, you start to see an alleviation of depression symptoms. So that's a very powerful device. It's basically you go 30 to 35 treatments. Roughly 30 to 40 minutes, depending on the intensity of the energy that has to be delivered into the brain. And over the course of about 5 or 6 weeks, you start to see people, the depression start to lift. And I had my own depression center where I had this device.
Right, yeah.
And I saw, right before my eyes, patients that would come in that could really barely hold a conversation. At the end of about 4 weeks of treatment, they start to be able to engage in full conversations. Based on testing, we started to see definitely an increase in positive affect and a decrease in depression symptoms.
So Chris, back at medical school, when I was doing, my medical school and then residency, we did have those kind of treatment centers, for the depression and for those people who are really very much major depression. But now things have improved so much. Yeah. We didn't have all this equipment. Right. So with these modern techniques and all this, I am very hopeful that this is going to work for especially, the next segment that you're going to talk about, post-traumatic.
Absolutely. Well, just highlight some statistics on transcranial magnetic stimulation.
Right.
There are a number of clinics around the country that are popping up that are servicing patients for this. Most insurance companies are covering this treatment. The average cost of treatment can be anywhere between $8,000 and $12,000. So it's not necessarily a cheap modality, but it has a very high effectiveness rate. When I was doing my research, because I actually did my dissertation on transcranial magnetic stimulation, and we found that at that time, and I think the statistics are pretty stable at this point, around 70% of people responded. And that response was almost a complete reduction in their depression symptoms. And then we also saw that 50% of patients had about a 50% reduction in symptoms. So overall, about 80% of patients who receive this type of treatment, they respond.
They respond.
And half may actually become completely asymptomatic.
Really?
So that's very exciting treatment. And the other thing is there's really no side effects with this treatment. As you and I know, there's a lot of side effects that can happen when you take antidepressants. And some of the SSRIs can, increase weight. Depending on the type of medication you're given, a person can have a number of side effects. And a lot of this population who are chronically depressed, they might be on 2 or 3 antidepressants.
Right.
And that can also increase their side effect profile. So this treatment actually can work with medication or work without medication.
I was going to ask you this question. With the medication, it can be done or without?
Yes, it can be done either or. What I experienced in my trial studies is that it seems that TMS might actually help the effects of the medication. Because, again, both the medication and the TMS are working on the same neural receptor sites. So between the combination of the two, it's believed that the energy might help the chemistry in terms of causing the depolarization, which is going to alleviate the depression. Yeah. So that's a very exciting treatment, and I was very excited when we got our machine, and then we started treating patients, and then it just really started to unfold from there.
So, Chris, is this an outpatient procedure?
This is an outpatient modality. Yep. You come every day, 5 days a week for about 6 to 7 weeks. Yep.
Okay.
And sometimes patients do require boosters. So the effects of TMS in the research suggest that the effects can last about 8 to 9 months.
Oh, that's very good.
Yeah, absolutely.
Excellent to know.
And then some patients might require boosters, and they might come in for 3 or 4 more treatments, and then go back out and that kind of thing. So it's very, very popular treatment, and it's something that I'm very excited about, and I just wanted to share that with our readers and our viewers.
Yeah, because we did it a couple of months ago. I think we briefly reviewed this in children's with depression post-COVID era.
Yes.
During the COVID era, but this is something we are started doing it now.
Yes.
And you are seeing a good response.
Absolutely. Thousands and thousands of patients have been treated. Absolutely.
Yeah, that's good.
So let's go on to our next slide and talk about our next treatment. This is a little bit different kind of a treatment.
Yeah, this is very interesting.
It is, and it's very scientifically
eye movement
researched.
Desensitizes.
Yeah, so let me explain a little bit how this treatment works, because you have to have a lot of training as a practitioner to really implement this type of treatment. It's an 8-phase process, and you go through different stages of the EMDR process to kind of get patients to process their trauma. So it's believed that trauma causes the brain to dysregulate. And as a result, the lobes, the left and right lobes are not really communicating effectively as it relates to processing trauma. So what EMDR does is it's kind of weird. You'll be in the office with the practitioner, and there's different devices where you might have a machine where the light will go back and forth. Okay. And so you'll sit there and your eyes will look at the lights going back and forth. Or the practitioner may actually move their finger back and forth, and you're supposed to keep your eye on the finger. And what that does is it causes both the left and right lobes to kind of integrate and to help process the trauma. It's a little bit more complicated to explain than that. I don't want to lose our readers and viewers and listeners into the technology of it, but it is definitely a very effective treatment. Not typically covered by insurance companies, but most practitioners will charge between $100 and $150 per session. This type of treatment could be lengthy in terms of how well the patient is responding to it, but I would say it's probably implemented in a 4 to 5 week period of time.
4 to 5 weeks, yeah. But what I wanted to ask you, all the time they have to be monitored with the EMG?
No, EMDR
does EMG have a role in this kind of?
No, there's no need to measure any vitals or anything like that. Even with the TMS treatment,
just the eye movement.
Just the eye movement. Yeah. It's very safe type of treatment, very well researched in terms of its effectiveness to process trauma and obviously alleviating the effects of depression that can be associated with trauma.
The reason I'm asking, when I was doing the research about this autism or what goes in the mind of the shooters, there was a good connection between what happens in the thalamus, amygdala, and what goes to the cerebral cortex.
Yes.
And is that the same mechanism? And that controls the optic nerve.
Right. They're all kind of connected in that way. So what I think EMDR is really trying to reprocess the trauma that is embedded in the brain system. And so by reprocessing it helps the patient to kind of go back into the memory of the trauma without experiencing the traumatic effects.
In other words, we are stimulating the hypothalamus area.
Yes, and the vagus nerves.
The memories store the memories, and cortex is
the hippocampus is primarily the memory. The amygdala, hippocampus, the prefrontal motor cortex, all these regions are kind of involved in the reprocessing part of this. It's a very intensive treatment. A lot of training to be certified as an EMDR therapist, but the effects are very positive in terms of helping people really process trauma.
If it helps.
Absolutely. And it shows to be very effective in the research. Probably roughly 60% of patients do respond to this type of treatment.
So for our viewers to know around the cost effectiveness, is this more reasonable than the first one?
Well, again, these are two different types of treatments. TMS is kind of beaming electrical energy into your brain.
Right.
EMDR is really trying to reprocess the trauma by having your lobes kind of reconnect in the brain. It's a very different type of treatment.
Okay. But the cost-wise, more or less the same.
Roughly a round of EMDR, depending on what the therapist charges and how many sessions are involved. It could get into a few thousands of dollars. TMS on the low end is roughly $200 a day, and you need 30 treatments, so that can get up to about $6,000 to $7,000 pretty easy. Yeah. Again, TMS is covered by most of the major insurance companies. EMDR, however, as far as I last checked, it's not really covered.
It's not covered.
It's usually a private pay modality.
Yeah.
But it's also a treatment that I think even, TMS and all of these treatments are almost last resort types of treatments. They're not necessarily your first round of treatment.
Right.
Although they can be, they're not likely to be. TMS for most patients, you have to have failed at several medication trials, at least 2 medication trials, in order to even qualify for the treatment. EMDR, you don't really have to have any qualifiers, but you also have to meet certain diagnostic criteria. EMDR probably doesn't work very well with patients who are schizophrenic and who have delusional disorders and that kind of thing. And even TMS is known to sometimes trigger bipolar episodes in certain patients. So we do have to really be careful, actually, who gets the treatment and do a very good evaluation and pre-screening.
That's very good to know.
Yeah, absolutely.
For our viewers to know the options which are available to them.
Yes. Yeah. So EMDR, and TMS and all the things we're talking about today are really treatments that patients might have had tried other things before, and then they'll try something like this because they can be expensive, out of pocket, and a little bit different than your classic medication and psychotherapy.
Yeah, right. Yeah.
Absolutely. Let's take a look at our next slide, and we can talk about our next treatment.
This is very interesting because I had one, I was interviewed somebody with the ketamine assisted treatments.
Yes,
and it seems to me like this is very...
It's exciting, I got to tell you.
Edge.
Now, ketamine has been out in terms of having been created. It's been out for decades. It's not a new drug. It's been synthesized. Yeah, it's been synthesized for probably about 50 years at least. The military is the first, group that actually probably brought that and we're starting to use it with soldiers and experiments and things of that sort. So ketamine is a sort of a dissociative anesthetic. So it's a drug that, you use in animal husbandry, and they use it for animal tranquilizing and things like that. Wasn't typically used for patients. Now, I did get kind of caught up in the LSD psychedelic movement where some people were starting to experiment with different forms of hallucinogens. But what we found in recent research is that ketamine, under strict medical protocols, and it's typically the way you administer ketamine, it's in a doctor's office, administered by a doctor. It's an injectable form of the medication, so the patient is given an injection of the ketamine, and it's sort of an office where they're laying down in like a bed or like a very comfortable reclining chair. Once the medication is administered, the onset of it, patients might start to feel a little disoriented. They may feel a little like a hallucinogenic kind of effect, not necessarily hallucinating, but starting to feel sort of a dysphoria, sort of a dissociation. Some people describe it where they're having sort of an out-of-body experience. So that kind of lasts for roughly about up to an hour in the treatment, and these patients are kept in the office under supervision until that phase of the medication kind of wears off. Okay. And then after that, patients are then typically doing therapy, where they're talking about their experiences that they had when they were under the effects of ketamine. I have a patient right now. She's in Colorado. She got her treatment in Colorado. She had 7 injections, 7 treatments over 7 weeks. and it was to help her with her depression, and it's really helped a lot. It's not been a perfect world for her, but we're doing the therapy to kind of process out the trauma.
So the role of ketamine is to stimulate the opioid receptors, right?
Well, it really affects...
Interacts with the receptors.
It interacts with the same types of receptors that LSD and psychedelic mushrooms affect, which is primarily the serotonin, the DA2 receptor, the serotonin. Yes, and so all hallucinogens seem to activate on that serotonintic system. So it seems to activate on the serotonin receptor.
Yeah, serotonin.
So, and again, a lot of these drugs, we don't really understand why they work necessarily. We just know that they do work. So the mechanism of action isn't well understood, even with psychedelics. We're starting to unpack how the neurobiology of psychedelics and how that creates the effects of relieving the depression and trauma. But with ketamine, it's not really fully understood how it actually works. But I actually talked to the researcher when this ketamine started, which was about 5 years ago.
Yeah.
In our clinic in Livonia, we were one of the sites that started the pilot project to do the ketamine project. So we actually had patients come in and start to receive this ketamine injection. And I was able to actually talk to the lead researcher who set up the whole national design and talk about the effectiveness of ketamine and the excitement in the research about it. So it's again another type of treatment that many patients are starting to hear about. So I kind of wanted to expose our viewers to this type of treatment. There are clinics in Michigan and around the country that are offering this type of treatment, not widespread. The doctors do have to be certified, and usually it's psychiatrists that are running the clinics or the ketamine clinics, and it's very effective. And so you'll find that patients are getting 6 or 7, maybe 10 treatments, and then the therapy is helping them to process out what they're experiencing while they're going through this sort of dissociative period. It's not a hallucination like mushrooms would do, and we'll talk about that next, but it's kind of creates a dysphoria and a sort of a personality dissociation, and it allows the person, all these treatments, EMDR, ketamine, and mushrooms, they help the person to re-experience the trauma without feeling the effects of the trauma. So that's like you're not re-traumatizing a patient when you're doing these treatments. Sometimes when I'm doing psychotherapy and talking to somebody, and we're talking about, let's say, a death or something happened, tragically, talking about it can actually re-trigger that person's trauma about the story that you're trying to help them get over. So these treatments actually allow the separation between the emotional response of the trauma, as well as processing out the cognitions and the feelings and the behaviors from the trauma. So that's why they're exciting.
Ketamine, when I was doing this paper about this in adolescent depression, I think CHOP, Children's Hospital of Philadelphia, I saw them doing this treatment. And also there was a study in the Baltimore study. So apparently this is getting to be more and more impractical, right, among the treatments.
I mean, again, remember what I said, that these treatments are for patients who didn't respond to your traditional medication and psychotherapy. So you've got a population out here. That's why I did my dissertation and my research on the TMS, because I was seeing patients in my practices
you have a practical experience.
Were constantly depressed, and they tried everything. And nothing was effective. And so the TMS and these types of treatments were designed to deal with that population where nothing else really worked. And so that's kind of why they're not really first-line treatments. They might be the 10th type of treatment a person has. Because your typical depressed patient who doesn't respond has typically been on 10 medications. They've tried up to 8 to 10 medications. They may have tried ECT, which is electroshock therapy, electroconvulsive therapy, which is not widely used today. But I do have a psychiatrist that still does ECT treatment. in the hospital. And so you find that there are a number of patients who are just chronically suffering for decades.
I know.
So when they see a ketamine treatment or TMS, they're really excited.
And it is non-invasive.
And they're non-invasive. And the research gives them hope that maybe they'll respond. And that's kind of what we're seeing in this unresponding population.
Exactly,
These folks are starting to respond. Keep in mind, TMS, to be admitted into the treatment, you had to be a non-responder. Exactly. And in the non-responding population, 75% responded. That's powerful.
Right.
That's very powerful. So anyway, so ketamine, again, is very exciting. You know, it's a different kind of a treatment. Right. You know, you're getting an injection. When you go in, you're going to lay in a chair until the effects kind of wear off. And you're going to be at the clinic for roughly 2 to 3 hours. And then go home. And then, you know, the therapy kind of comes in and we process out.
And this doesn't need to be hospitalized, right?
No, but
it's
some of these treatments are given in psych hospitals.
Okay,
sure, definitely. But no, these are all outpatient treatments. Absolutely.
Right, yeah.
But as you know, some hospital systems will have a TMS chair. They might have an EMDR therapist. They might even have an ECT, you know, system, and they certainly might start, you know, administering ketamine for depression. Okay. It has to be supervised, and because a lot of people in the drug using world have used ketamine inappropriately, illegally, to get high off of it.
Right.
So you have to be careful, you know, how this is, you know, pitched to the public, because ketamine can be a helpful drug, but can also be a dangerous drug if used inappropriately. Okay.
Right.
Yeah. So let's talk about our last topic.
Yeah,
we did a show.
Oh my God, the mushrooms! Do you remember when we did one last year, middle of summer?
Yes, I do.
About the psychedelic mushrooms.
Well, you know, since that time, I can report that the psychedelic mushroom and depression treatment is robust.
It is.
And I can tell you that many universities because, you know, psychedelic mushrooms are still a Schedule I drug, which means it is federally illegal. Okay. Now, in Michigan and Oregon and Colorado and I think California, they are beginning to decriminalize.
Legalize.
Right. Well, Colorado Oregon has legalized it. But many states are decriminalizing it. Now, that's different than legalizing it, making it legal. Decriminalizing it means it's still technically illegal on the books, but the state will not enforce the laws. So they're like turning their nose away from this whole industry. They're not really going to lock people up or arrest folks for the psychedelic mushroom. And that's on the recreational side. So Detroit, Ferndale, Highland, you know,
I see the sign
Hazel Park,
here and there.
Ann Arbor was the first city.
On I-94.
Yes, Ann Arbor was the first city to actually decriminalize mushrooms.
Okay.
So now therapists, especially in Oregon, or the state of Oregon, has now given license to therapists to use mushrooms in therapy.
Okay.
That's against the law, and that's against my code as a counselor to actually give a patient these psychedelic mushrooms or psilocybin, which is the active ingredient. But Oregon is now in a trial study licensing therapists to actually use psilocybin in treatment with patients, and that's that's really cutting edge. Now, I can tell you, I want to give a lot of precautions on the use of psychedelic
Of course,
mushrooms.
anything has a side effect.
So mushrooms like these, and there are several different ones that cause this sort of psychedelic, hallucinating effects. They're not toys. In my opinion, clinically, there really should not. Well, many of the people who use mushrooms, they're using them recreationally. Right. They're using them to have, trips and these experiences. But, depending on the dosage of the medication, I'm calling it medication because I believe it's ancient healing medication is what I think mushrooms are. But I don't think they're anything to be just used recreationally. I mean, I know a lot of people are using them and having trips and going to concerts and things like that. But my personal experience, I don't believe that people should really think about psychedelic mushrooms in that way. I want our viewers to look at mushrooms in this way as a healing compound that can really help you deal with some very deep, dark trauma and depression. It's a very different treatment. It's nothing that I would just recommend to anybody.
Right.
So here's kind of what happens when a person takes psilocybin. So psilocybin is a medication that will cause the mind to begin to start to hallucinate. And depending on the dosage will determine how intense the experience is. And many, neurobiologists and psychologists are now experimenting with taking mushrooms on their own and then describing their hallucinogenic mushroom
They're
trip.
experimenting on themselves.
Yeah,
right?
they are.
Yeah.
And we found that psilocybin is generally a very safe drug, irrespective of the history of people jumping out of windows and things like that. And I can tell you that with some patients and in high doses of mushrooms, you can get a very powerful anxiety, panic reaction, and some people might do some very weird and dangerous kinds of things when they're in that state. So that's why this model of using mushrooms with therapy is therapy assisted, just like ketamine is therapy assisted. It should be done in conjunction with a therapist.
With the other treatments.
Now, ketamine is going to be done with a psychiatrist or MD because of its being injected.
Right.
Psilocybin is it's a mushroom. You can eat it. You can take it in, tea. You can soak the mushrooms and steep them in tea. You can eat them naturally. You can grind them up and mix them with chocolate. And so people are taking it like that. So, so you don't need a doctor to be involved in the medicine with the mushrooms. However, when a person is going through that psychedelic experience, it can get to be a little scary for some folks because you're now dealing with the inner recesses of your conscious mind, where all of your trauma, all of the things that you experience in life are kind of embedded down into that area of your consciousness.
Right.
And so mushrooms, in a very weird way, they help you to access this information. And a lot of stuff that people have been experiencing that was trauma begins to surface in this psychedelic experience. So a person begins to re-experience some of their trauma while they're under this psychedelic experience, which can be a little tricky for some people.
Right.
So that's why, the model that I'm interested in, which is what I'm kind of setting up a practice once the laws become a little better. But in Detroit, I've talked to many officials, and it seems to be okay to start to practice as a practitioner, patients that have had their mushroom experiences and then come into therapy to talk about it.
Yeah.
In Oregon, they're actually giving them the mushrooms in the office and assisting them through a 4 to 6 hour experience.
Okay.
So they're actually with the patient for as long as the trip lasts. So the other model is to, help, for the patient to take the medication at home and then come in and talk about the things that they experienced during the trip.
But I have 2 questions to ask you, Chris. Are these, where are they getting this mushroom? Will it be any food store or a special?
It's a great question.
Area where
it's a great question. It's state by state.
Because I go to buy mushroom. There are so many kinds of mushrooms available. So how do I know which one is good? And another question I'm going to ask you is about, how about the children?
Yes.
Because children are
those are 2 good questions, and I got 2 different, 2 great answers. So as far as the distribution and how you get mushrooms, depends on the state where you're at. Obviously, these things grow wild in nature, but now people are becoming what they call mycologists and mycologist farmers, which is actually
the farmers,
they're growing these types of species of mushrooms. So, like in Detroit, for example, and in Ann Arbor, Detroit, Hazel Park, Ferndale, they're pretty much decriminalized, so dispensaries are popping up, just like in the medical marijuana system. You now have mushroom dispensaries. So you could go right now to a dispensary in Detroit or in these cities and buy mushrooms, hallucinogenic, psychedelic mushrooms, legally. Right. Now, while statewide, so if you go to another city that is not decriminalized, you could be arrested.
Right, exactly.
Right, so it's a little tricky. But you can get them legally in cities that are decriminalized.
Okay.
And many states, I think eventually Michigan is going to pass the initiative in 2025.
Because they legalize marijuana.
Yes, exactly. So they're going to probably do the same thing with
marijuana.
the mushrooms.
They will do the same thing with mushrooms.
Absolutely.
Also,
yeah. Now the thing with mushrooms is that I think that we should really remind our viewers that these are not toys. These are not things to just casually play with. These are ancient healing medicines. They've been around as long as the planet has, just like cannabis and other endogenous, medications. So, but I do know that, with the psychedelic experiences, some people can have what they call a bad trip. And, so you really want to be with somebody. If you haven't experienced the effects of a psychedelic experience, you really want to have somebody with you to kind of guide you through that experience. So, but as far as children, and I know we have to wrap it up, they're drugs that we, just like cannabis.
Just like cannabis,
we need to be careful.
Exactly.
Many children have taken edibles and have been in the hospital.
Yes.
This is cannabis, and we've even had dogs who have eaten chocolate cannabis, and they've ended up in the hospital. So these are not drugs to play with. Psilocybin is a very powerful drug, and is absolutely not appropriate for any child, and in fact, it may not be appropriate for some adults.
Right.
I think patients who have
schizophrenia. There should be an age limit. FDA will.
I'm sure
through
if
that age limit.
It's still the wild, wild west in terms of all of that.
Right.
In terms of but it's not going to be given to anyone who is a child under the age of either 18 or 21.
Okay.
I think in the dispensaries you have to be 21.
21, yes.
So that's kind of the whole spiel.
Yeah.
Those are the cutting edge treatments, that I think our viewers could do their own research and see if there's something that they, if they have any questions, they can always reach me at Dr. Shreve.
So Chris, I'd like to thank you for going through this cutting edge treatment for depressions, and I'd like to thank our viewers, and if anybody has any question, they can always call you, your website and your number. Everything is written. And I'd like to thank our producers for helping me produce this. And maybe during the course of all this, during the summertime, we'll do it among children and adolescents.
Absolutely.
And thank you again for coming to my show today. Very interesting topic, yes.
Glad you enjoyed it.
Thank you. Thank you again. Yeah.